If you've come across this video because your child is masturbating in public, the first thing I want to say is it's hard to be a parent. It's really hard, and I'm sorry that you're going through this. But the second thing I want to say is that it's actually very common and it's completely normal. In this video, I'm going to talk about masturbation in toddlerhood and babyhood and older kids. And I'm going to give you some tips for how to deal with it in a healthy way. I'm Karen. I'm a clinical psychologist, and my channel is about bringing mental health into everyone's home. If you'd like to hear more about matters relating to mental health and bringing mental health into your home, then please smash that subscribe button and, of course, the like button, because you know the algorithm. Studies have shown that tiny babies masturbate in the uterus before birth. Isn't that incredible? It is such a human biological phenomenon that it occurs before birth. And infantile masturbation is commonly seen in babies from around the age of 2 months old when they develop the motor control in order to be able to explore their bodies. However, this behavior is not sexual. Even though the baby or small child may reach orgasm, it doesn't make it sexual, because orgasm is a reflex. Kind of like if you tickle the inside of your nose with a piece of grass, you will sneeze. Often little babies and children do not use their hands to masturbate. They do things like rub their genitals on parts of your body or on furniture, or they use one of their pillows or one of their stuffed toys to self-stimulate. But sometimes they do use their hands. It's not completely unknown either. Children may insert small objects into their vagina or anus in the same way that they stick little peas and Smarties and crayons up their nose and in their ears. I just want to reassure you, you do not need to freak out. Small children may also masturbate in public, and this is because it can be quite a self-soothing behavior. They might be more likely to do it when they feel shy or awkward or under some kind of social pressure. And that's where it gets really embarrassing for you when your child is getting red-faced and breathless on the edge of the sofa when your family comes around for tea. The most important thing when your child is masturbating publicly or privately at home is do not shame them. Do not humiliate them. Do not speak to them in a disappointed tone of voice. Do not warn them that their penis will fall off or that they will go blind or any of those kinds of horrible myths that people use to make children afraid to masturbate. Maybe you worry that there is some kind of risk associated with masturbation. There isn't. There are no health risks or psychological risks, and it will make absolutely no difference to them and their ability to procreate later in life, and it will make no difference to their sexual maturation. Don't get angry with them. The best way to handle a very small child masturbating in public is to distract them. And it should be relatively easy to do so, especially if you know what they're doing and what their triggers are, what their cues are. Then you can distract them at the very beginning before it even starts. Distract your child with a toy or an activity or something to look at. You can also help your child to self-soothe in other ways. So for example, if they really love a particular stuffy, then let them take their cuddly toy with them or their favorite blankets or whatever it might be. When you're distracting your child or stopping them from masturbating in public, then use a normal voice, use a calm voice. Do not get agitated, because strangely, this can actually reinforce the masturbating behavior because it makes the child more anxious. They sense your anxiety. They become more anxious, so they masturbate more because for them, it is just a way of self-soothing, similar to sucking on their fingers or their thumb or some children pull on their mother's hair. These are all completely normal behaviors. There are things to watch out for. If your child has female genitalia, then rubbing and rocking and the kinds of friction associated with masturbation in small children may cause her to have some kind of UTI or infection. So if you see more itching, scratching, and rubbing than normal, then consider taking her to a doctor and ruling out the possibility of some kind of infection. Another thing to watch out for is if your child engages in sexual play or activity that demonstrates genuine understanding of real-life sexual intercourse, then that would not necessarily suggest that your child has been abused or molested, but it probably shows that they have seen you having sex or other adults having sex, or they've been exposed to porn. Another concerning thing would be if your child engages in mouth to genital contact with another child. That would also demonstrate understanding of real life sexual activity. If your child does this, then it's probably a good idea to go and see your pediatrician and just make sure that there is no physical evidence of some kind of real sexual activity, and trying to investigate and find out how did your child come across porn, or how did they manage to see somebody engage in actual sex. Acting out penis to vagina sexual intercourse or mouth to genitals sexual intercourse is concerning. It's not necessarily the end of the world, but further investigations should be done. To summarize, children engaging in masturbation, even to the point of orgasm, is completely normal. Whether they do it without hands or with hands, whether they achieve orgasm or they don't achieve orgasm, it's not sexual. It's part of exploratory body play. The most important thing is to not shame your child, not embarrass your child, not shout or scold your child, but rather to distract your child. Once your child reaches the age of about 4 to 5, depending on their level of comprehension and verbal understanding, then you can begin to talk to them about things we do in private and things that it's okay to do in public. And you treat it pretty much the same way as you would treat your child picking their nose. If you found this video useful, then please let me know in the comments. And if you have any questions and you'd like me to make a video to answer those questions, then please do drop me a comment.